But if, but you know, just sort of supportive stuff. You know, I guess the best thing to do is to give the person or help give the person some time off. You know, that doesn't really have a lot to do with the emotional roller coaster directly, I mean, with what you're talking about, but it does help prevent the burnout. I mean, folks definitely need a break, and you know, 24/7, you can't do that very long without, you know, you need a break. So when it comes to the emotional roller coaster part, you know, the way I would think about this is in the brain, you realize that memory is very, very tightly tied to lots of different things. You can see something and remember it, right? Or remember something. You can smell something and remember it. I remember Grandma's apple pie. You know, she would bake that and I'd come in the house. So there's many different ways to get to the same memory. So, you know, all the different senses is one. Emotion is one. You might have an emotion that reminds you of something that happened years and years ago. So there may be a time where the person with Alzheimer's disease, they've lost maybe 3 or 4 of the pathways to get to that memory, but they haven't lost the other one. Maybe they haven't lost the ability to, you know, to smell, and it reminds them of the flower garden they went to see 20 years ago, where they just had this great experience, this beautiful flower garden, and then they bring that up to the family. It's like, remember when we went and did that? And the family goes, oh my gosh, how did she remember that? Because, you know, there's still one connection that got there, and that smell, that did it. That sent that memory right through. So until you lose all of the pathways, there's going to be sort of some random firing almost. It's not really random, but you know what I mean. That brings back memories that they haven't had for a long time, and you were sure that they forgot. So that causes sometimes an emotional roller coaster, because I think folks then think they're okay, they're better. And they're not. It's just like I said. So. Any other questions? Yeah.
Are there resources you can refer people to, like she was talking about?
Yes. The biggest thing I think is the questions about resources. What do you do? Where do you refer somebody who's giving care for somebody with Alzheimer's disease? Where would they go to get support? One is that most communities have Alzheimer's associations, which are it's a group that's put together and it knows about all the type of support. It may even have names of folks who can come in and give you a break. They know about a lot of stuff, and they can refer you to legal people to help with legal issues. You know, you're going to need guardianship and things like that eventually. But there also are support groups for people who are caregiving for patients with Alzheimer's disease. And I know Newcastle has one, and there are some, you know, I'm not sure if Hagerstown has one or not. It's a fairly small community. But certainly Richmond would have one, I'm sure, and Indianapolis has several. So those are very, very helpful, because what you're going to have there is you're going to have caregivers who are taking care of patients with Alzheimer's disease at all different stages. So you might have one person who's taking care of an Alzheimer's patient who's in a severe stage, and one person who's in a more mild stage, and they can all sort of give each other advice about, oh, you know, here's how I handled this one, here's how I handled this. That's incredibly important. You know, just knowing you're not in it alone. You know, that's incredibly important. So the way to find those is like in Newcastle, I think they go through the hospital. You call the hospital switchboard, and they'll tell you who to get in contact with for the Alzheimer's Association there, or the support group there. And usually the hospital is a good place to go. And you can even look in the yellow pages to see if they have ads, but a lot of them don't have a lot of money, so hospital might be a good thing. Other questions? All right, now next month, we're going to have one next month, you know, the third Tuesday again, and then in December we're going to take off because it's getting close to Christmas. Do people want to, there are several different options. There's a lot of stuff we haven't talked about. I'm not sure what the interest is at this point. You know, we've covered the stuff that was sort of high on people's lists, but there's anxiety disorders. Those are fairly common. We could either, I don't know if I can cover all the anxiety disorders in 1 hour, but there's panic disorder, generalized anxiety disorder, post-traumatic stress disorder. Those are all obsessive-compulsive disorder. Those are all anxiety disorders. We could do a couple of those in one session and a couple of them in January. Or we could do bipolar disorder. We haven't done that. We haven't done personality disorders. We haven't done psychosis, like schizophrenia. Well, psychosis, but schizophrenia and the other illnesses like that. So I guess, I don't know, can I see a show of hands, maybe a bipolar disorder? Who wants to hear about that? Okay. All right, how about the anxiety stuff, anxiety disorders? That's not even. Okay. Well, I don't know. We just did depression, so why don't we do bipolar disorder first? Because depression's part of that, you know. So maybe the depression stuff will be fresh in the mind, and then we'll talk about bipolar disorder. And then the next time, then we can start with in January. Then we can start with, and then in January and February do the anxiety disorders, and then March, April, and May will be open. We'll decide what to do there. Does that sound like a plan? So bipolar disorder it is. Thanks, guys. Thanks everybody for coming.